We'll get started with some sobering numbers on this, the tri-state's deadliest day since the start of the coronavirus pandemic. New York, New Jersey, and Connecticut all hitting new highs over the past 24 hours. The region's combined single-day death toll topping 1,000 for the very first time. Among the dead, 22 residents of a single New Jersey nursing home, 10 of whom are confirmed to have been infected with the virus. Tonight, the Elizabeth Nursing and Rehabilitation Center is closed to new admissions, but the mayor there says that's still not enough.
I think the nursing home should act rather quickly in segregating the patients either on one floor or another floor and then disinfecting the place, as well as put in place a protocol for all of the staff that are coming in and out of that building.
Tonight, News 4's Checkey Beckford kicks off our team coverage live outside of that facility where the head physician, Checkey, also has tested positive.
That's right, Stefan. And even before that, we're going to talk about a South Brunswick family that's been hit even harder by this tragedy. A South Brunswick woman tells us that both her mother and father tested positive for COVID-19. And then on Sunday, her sister began acting strangely. Then yesterday, the unimaginable happened.
A family's heartbreaking tragedy. A mother and daughter die Tuesday within just hours of each other.
The only hope that I have out of this is that she knew Amanda was gone and she needed to be with her daughter.
Jessica Ingaglio says her mother, 70-year-old Rhoda Ruiz, was hospitalized last week with COVID-19. Her sister, 33-year-old Amanda, began acting strangely Sunday.
She was getting sick. She was throwing up.
Ingaglio says her sister, who had diabetes, was incoherent and lethargic. She called for an ambulance, warning EMTs her mother and father both had COVID-19 and that her sister may have been exposed. But she says EMTs told her Amanda refused to go to the hospital.
They said, well, there's nothing we could do because she doesn't really want to go. And I begged them to take her, begged them to take my sister because that is not her and something is very, very wrong.
The next day, her sister was found dead inside their South Brunswick home.
She was never tested, and that's why I do not want her to have, she might have had it. She might have had it. Who knows? Anyone can have it and not show symptoms.
Her father also hospitalized with COVID-19.
I called him and I had to tell him his daughter was dead and his wife is dying to be with her. They have names and they had beautiful lives and they loved as hard as they could with everyone they knew. So I just want, people to know that they're not just a number.
Just a heartbreaking story, and she tells us that her father is recovering. Now, a person with the Kendall Park First Aid and Rescue Squad told us over the phone that if a patient refuses to go to the hospital, that they are not transported, that is protocol, but that only the chief could officially make that statement. Again, we've tried to reach the chief a number of times, but have not received a response. We're live in Elizabeth tonight. Checkey Beckford, News 4 New York.
Your heart just breaks for that family and what they're going through. Checkey, thank you very much. Also in New Jersey, a daughter's desperate plea for answers after her mother died at an acute care facility. Kathy Mullins says her mom, Claire Collins, was found dead yesterday in her bed at Atrium Post-Acute Care in Park Ridge. She wants to know if her mother had COVID-19 because she believes the pandemic will only get worse if deaths are not reported. But Kathy tells us Atrium Post is refusing to test her mother.
I felt that that was the only way we were going to find out if my mother was indeed died from COVID. And we believe, that the fact that she was coughing on Saturday, went to bed Sunday night, didn't wake up on Monday, and there's COVID in the nursing home, and probably.
News 4 has reached out to Atrium Post-Acute Care several times tonight, but we couldn't get anyone to comment on this story.
The city's death toll soared past 4,000 today, eclipsing the number killed at the World Trade Center on 9/11. But despite this grim milestone, hospital admissions appear to be dropping. News 4's Villeda continuing tonight's team coverage live outside of the Javits Center. It's one of the latest field hospitals to start caring for COVID-19 patients, Ray.
That's right, Natalie. And these field hospitals are seeing dozens of patients, but that's about to change. That's because by the end of the week, both the Javits and Comfort will have a combined 200 ICU beds. It comes as New York is seeing the deadliest day of the pandemic, but tonight, a glimmer of hope.
It was inevitable but I just don't want to believe it.
Dr. Sion Farouk living the reality that is COVID-19 in New York City, an ER doctor now living with the virus.
I'm counting down the days to go back to the emergency room.
And she will be needed. New York just had the largest spike in deaths yet. 731 people died in just 24 hours. Despite that grim reality, a glimmer of hope. Governor Andrew Cuomo thinks New York is reaching a plateau, with the average number of hospitalizations going down.
The 3-day average is down, which is good news.
And evidence social distance is working. The governor and mayor reminding folks to be vigilant. Chopper 4 capturing these scenes at city parks. Groups working out together, playing ball yesterday. Today, park workers netting exercise areas.
Anyone who sees crowding or people are not socially distancing, call 311 right away, and we will send enforcement agents immediately.
Large field hospitals still remain largely empty. The Javits Center and USNS Comfort only have about 110 patients combined. Now there are plans to turn the Cathedral of St. John the Divine into another field hospital. There is also talk of moving forward. Today, Governor Cuomo says it will be a group effort with Connecticut and New Jersey. The governor says testing will be key.
You're going to have to know who had the virus, who resolved the virus, who never had it.
New York already ramping up test kits, which test for antibodies. The results would be available in minutes. The FDA has given approval for it.
We're hoping that that will ultimately give more insights for the health departments of how it's being spread.
Testing to help move forward. Well, testing for the virus is still a struggle for New Yorkers and even its frontline heroes, like Dr. Farouk.
So when seeing asymptomatic White House officials and celebrities, animals at the zoo getting tested, and us healthcare professionals not offered this test at this point was very frustrating.
Frustrating because she says a tiger was tested and it took her 3 or 4 calls to finally get a test. She says she was even turned down by the Department of Health. Testing still an issue as New York enters what is expected to be a tough week in its fight against COVID-19. We're live on the West Side tonight. I'm Villeda, News 4 New York.